We begin with a look at COVID numbers across the state. 372 new cases were reported today, along with 10 new deaths, 8 on Oahu and 2 on the Big Island. All were hospitalized with underlying conditions. The state remains at 67.2% fully vaccinated. September has been the deadliest month when it comes to COVID-19. Nearly 200 people have died in just the last 4 weeks. It's the only number that continues to climb as the state trends down from the recent surge. One COVID treatment could help keep our hospitals from becoming overwhelmed once again. Nikki Schenfeld explains.
Monoclonal antibody treatment has been used in Hawaii for months, but became increasingly popular during the Delta surge.
What they are is essentially a mimic of what our immune system creates. If you're vaccinated and you create antibodies, you've already done the job pretty much.
He says treatment does not provide immunity, but helps mild to moderate COVID cases.
Usually within 24 hours, people start to see their symptoms diminish if it works. It's not guaranteed at all. Essentially what it's doing, it's giving you kind of a boost of antibodies that you would have otherwise gotten if you were vaccinated.
People who get COVID, if they're high risk, if we can administer this treatment within the first 10 days of their illness, it's about a 70–75% reduction in people getting serious disease, going to the hospital, and potentially dying.
Doctors say people should get tested at the first sign of symptoms because treatment should be sooner rather than later.
Once you are oxygen dependent, like you're short of breath, you need oxygen, or you need to be intubated, it's too late to get monoclonal antibodies.
There are roughly 200 fewer COVID hospitalizations than 3 weeks ago. Health officials say it's too soon to know if the treatment is why hospitalizations have dropped so quickly.
The fact that they are being used more widely now than what they have been is a good sign, and it definitely would be reducing the number of hospitalizations.
The treatment is in high demand in states where vaccination rates are low. It's resulted in the federal government sending limited quantities to Hawaii and states with higher vaccination rates.
So that it does mean we have to be more selective in terms of who actually gets the drugs.
Schaefer from Waianae Comprehensive says COVID-positive people over 65 or who have underlying health conditions like diabetes or obesity qualify for treatment. On Tuesday, Rathel said the state will receive 600 doses this upcoming week. The health department says it distributes doses based on county population and where hotspots are. According to the health department website, the Leeward Coast continues to report the highest number of COVID cases, followed by Waipahu and Nuuanu to Moanalua. On Hawaii Island, Hilo still has over 200 active cases. Kahului Maui has over 100 active cases, and Kapa'a on Kauai has a high number of active cases too.
Protect yourself up front. Don't wait to get infected and then hope that one of these doses or treatments of monoclonal antibodies will be available to you, because there's no guarantee, number one, that you'll be a candidate for it, and number two, there's no guarantee that the monoclonal antibody is going to save your life. So get vaccinated up front.
Nikki Schenfeld, KHON2 News, working for Hawaii.